Hi everybody, I'm Ellen with Advanced Massage Therapies in Carrollton, Georgia, and today I want to talk to you a little bit about how to choose a therapist for post-plastic surgery. So being qualified for post-plastic surgery requires a lot of training. It is much more than just being a lymphatic drainage therapist, but let's start with the varying different degrees of lymphatic drainage training. Bare minimum entry-level training for lymphatic drainage is about 20 to 24 hours. That is just one entry-level class. If you're looking for someone for post-plastic surgery, they need to have a minimum, a bare minimum of 40 hours training. And that is not two entry-level classes. This is an entry-level class plus an additional intermediate type class that's going to include training for post-plastic surgery. A highly qualified therapist is going to have 100 or more hours. A therapist who has been through a LANA approved program, that is the Lymphology Association of North America. They require a minimum of 135 hours training, and they do have a list of approved schools. There are about 10 of them here in North America. You can check that out on the LANA website. Just Google for Lymphology Association of North America and you can find their training programs listed. If you're looking for a therapist, you can go to each individual school and they will have their graduates listed there. So, we've talked a little bit about lymphatic drainage. What else is there to post-plastic surgery recovery? Well, it's going to include varying different things depending on your therapist. In my office, I include far infrared mats. Far infrared mats help reduce aches and pains. They speed up healing and they are deeply relaxing to be on. My clients absolutely love them, whether they're coming for post-plastic surgery work or any other type of work. All of my tables have them and my clients are completely addicted to them. They are absolutely a client favorite. What else do I include? Well, I include light therapy. I use red, yellow, and blue light therapy. I can do combinations of red and yellow or red and blue light therapy. So what do these therapies do? Red and yellow help speed cellular healing, they reduce musculoskeletal aches and pain, and they help reduce inflammation. Blue light therapy can be done on its own or also incorporated with red light therapy. The blue light helps kill bacteria. So if a person is starting to have an infection, I can do the blue light therapy and the red light therapy to reduce inflammation, help reduce that infection, and get it healing faster. I am also a certified Medicupping therapist. Medicupping is different than regular manual cupping. It is done with a machine, so I'm able to dial in specifically how hard the suction is, and that really does matter, particularly when it comes to post-op. I need to be able to know exactly how much suction I'm using, be able to repeat that, and have measurable results. Also, the cupping machine allows me to have either a constant suction or I can do different pulsing rhythms on and off. So why does this matter? Well, it helps me with clearing any debris and congestion that may be still in the tissues after liposuction. And then as the body starts to heal, we can also work with reducing fibrosis and also working with the scars, helping them become much more soft, much more pliable, much more flat. The cupping work is always gentle, and I'm always getting my clients' feedback to make sure that we're working within their comfort level. Also, as someone starts to heal, there may be some restriction in range of motion. Often I find ladies who have tummy tucks are having a hard time being able to get that full range of motion, raising their arms up above their head. So what we do is when that time comes later on in the therapy, we're working with the fascia and helping increase range of motion and get that back for the clients. For my ladies who have had breast implants or breast reduction surgery, I am also working with the implants to free them up against the back of the chest wall and make sure they're moving within the pocket. I often will have surgeons who send their patients over to me to do a little bit of work where they may have problematic breast implants. Also, with the if it's been a fat transfer or we're dealing with a breast reduction surgery, when we reach that particular time in healing, I am working with getting all of that tissue so that it is settled and feeling much better to the client. So I hope this video has helped you in understanding a little bit about what to look for when you're searching for a post-plastic surgery therapist. If you appreciate this video, give it a thumbs up. And if you're watching on YouTube, please subscribe to my channel. I really appreciate it. It helps the channel grow. And thank you again for watching.